The vagina can get so tight in such a way that the penis, vaginal applicator, speculum, and even the finger cannot even penetrate. And this person is not a virgin. Good day, everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Mercy Mary, popularly known as the Nurse with a Difference, and I make learning easy and accessible for all my viewers. Today, we're going to be talking about vaginal tightness, which in the medical term, it is known as vaginismus. We're going to be talking about the causes, how to treat it, and also what you can do about it. But before we go into details into this class, if you are new on our YouTube channel and these are content you are interested in, which is your reproductive health, please click on that subscribe button, turn on that notification bell so you don't miss out. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Let's go there. All right, welcome back. Let's go straight into the point without wasting your time. So the first question is, what is this vaginismus? Vaginismus is a condition in which the vagina tightens up when you try to insert something into it. It can really be painful and upsetting. We can also say it is the body automatic reaction to the fear of some certain things or all things being inserted into the vagina. When it comes to vaginismus, during penetration, the muscles of the vagina usually tightens up. They are no longer relaxed. They tightens up. And when they tighten up, when you try to penetrate, it becomes difficult for the penis, for the speculum, for the finger, and other things to go into the vagina. Normally, as a lady, you have control over the muscles down there. But when it comes to vaginismus, you don't have control over the muscles down there. So that is why when penis or any other things are trying to go in, the vagina suddenly tightens on its own without your permission. That takes us to the different types of vaginismus. We have the primary vaginismus and we also have the secondary vaginismus. For the primary vaginismus, this refers to a situation in which no form of vaginal penetration has ever taken place before. Like no form of vaginal penetration has ever been enjoyable, has ever been fun, has ever been possible. And this could be as a result of stress, anxiety, mild inflammation that is usually painful during penetration, and it could also be as a result of thrush infection. Then that takes us to the second type of vaginismus, which is the secondary type. In this secondary type, situations in which pain-free penetration has been achieved. Before, you were having pain-free penetration, you could enjoy sex, but all of a sudden, you are now having painful penetration. When things are being inserted, you're having painful penetration. So that is a difference between the primary vaginismus and the secondary vaginismus. And this secondary vaginismus could be as a result of childbirth, perimenopause, or menopause. So these are the different types. So whichever one you are experiencing as a lady, is advisable you seek help to make you enjoy sex properly. So now we know the different types of vaginismus. Let's talk about the causes. One of the causes of vaginismus is anxiety and also fear that, oh, my vagina is too small. That's tension. The second one is past painful sexual encounter or past first time sexual experience. Maybe during the first time you had sex, you never experienced it well, you had pain, you were abused or things like that, or you were forcefully raped. That can create that fear, anxiety in the body that whenever penetration is going to take place, it's going to make the vaginal muscles tighten up. So another cause of vaginismus could be painful medical examination. Maybe during your medical examination, the speculum was excited. The experience you had during that first medical examination was not pleasing. And because of that mindset, you find it difficult to actually control the muscles down there. And the muscles down there automatically tightens up when it experiences any penetration at all. So another cause could be believing sex is shameful or wrong. Then another is a painful medical condition like thrush. So thrush can cause painful penetration when having sex. trust can cause vaginismus in general. So then that takes us to how do I deal with it as an individual? When it comes to treatment and management, the first one I have to share with you is managing your feelings around penetrations. Yes, managing your feelings around penetration. So if you are having that fear, you are having anxiety, you are tense, you just have to try as much as possible to calm down, relax yourself, and manage that feelings, because sometimes this vaginismus may be as a result of your mindset, what you are thinking about sex, your past experience, post-traumatic stress disorder, or things like that. Then the second one is exercise. So I've always talked about the benefits of exercise when it comes to sex and the women health, and most importantly, Kegel exercise. Yes, Kegel exercise. I've made a video about Kegel exercise, and I believe if you've not watched it, you can watch it and also see the benefit of Kegel exercise. So Kegel exercise generally helps to increase the blood flow down there. It helps you to give you control over the muscles of the pelvic region. So that is going to go a long way to help. And another way to sort out vaginismus is psychotherapy. Yes, you need to see a psychotherapy. I'm not a psychotherapist, but a psychotherapy will be able to have one-on-one conversation with you, tell you what is needed, help you control your emotions, and help you to deal with it effectively well. Another thing that is likely going to help is your relaxation technique. Taking a deep breath, a nice deep breath, trying to relax yourself and also relax your vaginal muscles. Then another is sensate focus. When it comes to sensate focus, this exercise to help with your relaxation during sex and also increase your sex drive. Then the other one is vaginal trainers. So these are the various ways to help with vaginismus. I know sometimes this can be really upsetting, disheartening, painful, and annoying, especially when you have been having a pleasurable sexual experience before, but all of a sudden it's no longer pleasurable. It can be really heartbreaking. So, what I would advise you is to focus on the mindset. Place a good mindset, see a psychotherapist if you can't really sort it out. And I believe it's going to go a long way to help. And I also want to let you know that you are not alone in this. Don't feel you are alone, you are the only one suffering or battling with it. You are not alone. There are a lot of people battling with vaginismus, but it's high time for them to speak out and get useful help. So thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy saying thank you. Bye and see you in our next video.